Let's stick with that story and speak to eNCA's Heidi Jokos, who is at the Charlotte Maxeke Johannesburg Academic Hospital for an update for us there. And Heidi, you continue to monitor the situation there. What's it looking like today in as far as the vaccination of healthcare workers is concerned?
Well, Tulis, when we were here about 2 days ago, there were an influx of people that were here at this vaccination centre here at Charlotte Maxeke, but it was not what you are seeing now. I'm going to ask my cameraman Shahid to just show you. There are a number of people that have gathered here outside of the vaccination centre, specifically at Gate 8 of the hospital, and of course they are trying to get vaccinated. We do know that the Sisonke trial is supposed to conclude in the next day or so, as phase 2 is expected to begin on Monday, but there seems to be quite a rush to get as many people vaccinated as possible. Of course, there are some reports that those who aren't healthcare workers or support staff have also taken their chances to get the vaccine, and this speaks exactly to what eNCA saw 2 days ago when we were here and we saw a number of elderly and senior citizens in the queue. We were actually told by staff here at the vaccination centre that they were not healthcare workers, but rather senior citizens that had attempted to get the vaccine. Because they are senior and elderly, they were not sent away. But as you can see, the queue is stemming all the way back to this hospital, and of course it seems only to be getting worse because time is running out for healthcare workers and support staff to get the vaccine. And we've also seen how the DA Shadow MEC for Gauteng Health coming out and saying in a statement that he's extremely concerned about the influx of people that have come to the various vaccination centres in Gauteng, specifically here at Charlotte Maxeke, and many are unaware of what the actual delay is. If phase 2 is supposed to begin on Monday with senior citizens expected to get vaccinated, how are they expected to stand in such long queues and wait for the vaccine? So this is of course going to be quite a concern and an issue that the Department of Health urgently has to deal with.
So a few days ago, I don't know if it's yesterday, you were reporting waiting times of about 4 hours from the time that a person arrives to the point at which they get their jab in the arm. What's your sense of how long it's taking at this moment?
Well, we've spoken to a couple of people who've actually told us that they have been in the queue yesterday as well for over 10 hours. So just add 6 hours onto the initial 4 hours that we got on Monday, where people were saying they had been queuing from about 6:30 to 9:30, 10 before they actually got the vaccine. And because we were inside on Monday, we actually know how the process works. If you do not have a voucher, you then need to be screened, re-registered, so a voucher can be issued to you, and then you moved over to be screened, and then you're taken into the vaccination centre, where there is still a lengthy process there because they cannot vaccinate everyone at the same time. There are certain rows and a certain amount of people that they can vaccinate at one time. So it's actually mind-boggling to us that there has been such a slow process and turnaround time in terms of vaccines, because if the Department of Health is estimating to vaccinate senior citizens, which is over 5 million by June, that means they need to vaccinate 120,000 people per day. If we are only vaccinating between 10,000 to 20,000 a day, and this is only in the last 2 days where we've seen an uptick in the number of vaccines administered per day, what is Monday going to look like? So I think this is just a grim picture of what we can expect on Monday. Hopefully things are sorted out before then, but unfortunately there's just too much traffic going on here. But I would have actually asked my cameraman if he can just show you on this side, if we can just take a walk and just show you on this side how there's another queue. So it seems to be two separate queues, and we do understand it speaks to those who do have vouchers and those who don't have vouchers have been separated into two different queues to be assisted. So as you can see on my left-hand side, there's a separate queue over here. Some people we've spoken to were told that they were told to come back today after they were given a voucher yesterday because of the cut-off time. But still, nobody knows what the plan is, and everybody is waiting. Zero social distancing, as you can see, that is also another big concern.
Lastly, Heidi, I don't know, and I'm trying to gauge your sense here as to why it is that we are seeing queues that have not characterized the Sisonke project, right? I mean, we've seen scenes of people inside specific venues seated and being marshaled in terms of where they start, in terms of screening and how they make their way all the way to the point at which they are vaccinated. But we've certainly not seen queues in the way that we are seeing at Charlotte Maxeke right now, at St. Augustine's right now. And I'm wondering what your sense is. Is it your sense that the looming cut-off of the Sisonke project, as you say, a day or so to go for that project, or is it an issue of, last minute to say, people left it until this minute, or another element being that people just never got the vouchers, and now, with time running out, they're deciding, let me just show up?
I think it's a number of things, Tulas, more specifically a lack of communication from the Department of Health with regards to the Sisonke trial ending. We do know that that trial was put on hold for about 2 weeks when the Johnson & Johnson vaccine was put on hold. So it's a number of things that have resulted in what you are seeing at a number of vaccination centres across the country. It speaks to the fact that people are rushing at the very last minute. It speaks to the fact that people didn't know that they could get vaccinated. It also possibly speaks to the fact of the reports that we are hearing about people skipping the queue and getting vaccinated when it's not their turn to get vaccinated. We've seen it with our own eyes. We have footage of this where people were in the queue and they were not healthcare workers, so all support staff. So it's a number of things that speaks to what you are seeing now, these visuals that you're seeing playing out across the country, where it's a last-minute rush to get a vaccine as Sisonke is ending. And what's interesting to us, quickly, I must add, is that when we spoke to co-lead investigator Professor Linda Gale-Becker this morning to get a sense of what is going on, there are reports, there's clear evidence that people are getting the vaccine when they shouldn't. She told us that what's crucial here is that if they do not reach the 500,000 mark by the time the Sisonke trial ends, those vaccines that are left over will basically go to waste. They cannot use those vaccines for phase 2. So that is immense pressure to get as many as vaccinated as possible and reach the target of 500,000.
All right, that makes sense. Thank you for that. And I suppose we should keep checking with the lead investigators of that Sisonke project as to where they stand in trying to reach that target of 500,000. That's eNCA's Heidi Jokos at the Charlotte Maxeke Johannesburg Academic Hospital.